Have you ever canceled plans with friends because you couldn't face getting dressed on a high pain day? Your wardrobe shouldn't be another casualty of chronic pain. Today I'll share advanced appearance strategies that have helped many people living with persistent pain, from CEOs to teachers, from those on disability to retirees and homemakers, show up for life's important moments. The psychological impact of looking put together goes far beyond vanity. It's about reclaiming your identity. If you find this helpful, please like and subscribe to support the channel. Greetings. It's nice to see you again. And those here for the first time, you're very welcome. In our previous video, we explored the basic principles of the image component in our AIM system. Today, we're diving deeper with advanced strategies to maintain your appearance even during those challenging pain episodes you may be experiencing. Before we begin, it's important for us to briefly review the science behind why appearance matters in pain recovery. Research in behavioral psychology has consistently shown that chronic pain patients who maintain regular grooming routines often report improvements in mood regulation and pain perception. Studies in neuroscience have also shown that self-care behaviors directly influence inflammatory markers and pain signaling pathways. When we dress intentionally, we activate brain regions associated with agency and self-efficacy, psychological resources often diminished by persistent pain. This isn't about vanity, it's about neurological intervention. These techniques apply whether you are working outside the home, managing a remote career, on disability, or primarily homebound. First, let's explore the fluctuation strategy. Preparing for those days when maintaining your appearance becomes especially challenging. Jennifer, a 45-year-old marketing executive with rheumatoid arthritis, developed a 3-tier wardrobe system after noticing her professional image was suffering during pain flares. Her condition causes painful joint inflammation, making buttoning shirts and styling hair nearly impossible on her worst days. Jennifer created what she calls her 3-tier system. Tier 1 consists of her good day outfits, tailored business attire with accessories for client meetings. Tier 2 includes her medium day outfits, simpler professional dresses with cardigans for regular office days. And Tier 3 features her challenge day outfits, pull-on pants with elastic waistbands for video calls from home. The key was removing decision-making on difficult mornings by organizing her closet in 3 sections and then being able to select the appropriate tier in the morning based on how she felt. Within 2 months, her colleagues noted that her consistent appearance helped maintain her leadership presence, even as she navigated her rheumatoid arthritis. Next, let's look at strategies for those primarily working or recovering at home, which is what many of us end up doing with chronic pain. Elena, a 38-year-old former pediatric nurse, is now managing a virtual patient education program while living with complex regional pain syndrome. And so she developed her structured dignity system after realizing she had spent 3 weeks in the same 2 outfits. CRPS, or complex regional pain syndrome, causes severe burning, making even light fabric contact unbearable at times. Elena's system includes 3 components. First, a simplified morning routine for high pain days, changing from sleepwear into comfortable but distinct day clothes and completing just 3 essential grooming tasks. Second, she created comfort stations throughout her home with necessary grooming essentials, allowing her to maintain her appearance without the difficult trips to the bathroom. Third, she scheduled regular video calls as motivation to maintain her appearance, even on her most challenging days. Elena noted, "Getting dressed helps me mentally separate recovery time from living my lifetime, even though both happen in the same space in my home." Many people with chronic pain worry most about special occasions, moments they don't want to miss despite physical challenges. A person like that is Michael, a 51-year-old high school history teacher with ankylosing spondylitis, and he was worried about missing his son's college graduation due to a flare-up. His condition causes progressive spinal stiffness and significant pain that can flare up unpredictably, making social events especially challenging for him. He developed what he calls his event success strategy with three main components. First, advanced preparation. Michael started scheduling haircuts 3 to 4 days before events and testing his dress attire at home to identify potential pain points. Second was his energy preservation technique. Michael discovered that getting fully dressed in his formal dress attire all at once would deplete his energy reserves before he even left the house. Instead, he developed what he called a staged dressing approach, resting for 30 minutes before starting, and then putting on one dress item at a time with short sitting breaks in between. Those of you in pain, I'm sure you can relate to this kind of challenge. This methodical approach meant he arrived at events with energy reserves still intact. And third was strategic participation. He developed his 20-10 rule, 20 minutes of social engagement followed by 10 minutes of finding a comfortable position or taking a brief walk to stretch his body. Using this protocol, Michael fully participated in his son's graduation while effectively managing his comfort throughout the event. Now I have a system that helps me be present for life's important moments, he said. Michael's approach highlights something I've observed across many successful pain recovery journeys: the careful balancing of physical comfort with personal dignity. This balance is so important that I've developed a simple exercise to help you find some dignity for yourself. Now I'd like to share this simple but powerful exercise. I call it the comfort dignity balance. Think about an upcoming event where appearance matters to you. Take a sheet of paper and draw a line down the middle. On the left side, write down your specific appearance challenges. On the right side, list possible solutions for each challenge. For example, if doing your hair causes shoulder pain, your solution might include a low-maintenance haircut, maybe a stylish hat, or a simple style you can prepare the evening before without aggravating your shoulders. The key is to rate each solution twice, once for physical comfort and once how dignified and put together you'll feel by accomplishing it. Choose the options with the best balance of both. This simple exercise shifts your thinking from, I can't look good because of pain, to, how can I look my best while managing my comfort? The goal isn't perfection, but participation, finding ways to remain engaged in the life you want to live. The advanced image component isn't about looking a certain way to please others. It's about supporting your identity beyond pain and creating systems that work for your unique situation. I'd really love to hear which of these strategies resonates most with you, or maybe you have additional techniques to share. Your insights might help others in our growing community. Please let me know in the comments. In our next video of the AIM system, we'll explore the third component, which is management, and that involves putting purpose into your life despite persistent pain. So it's bye for now, and I'm wishing you a comfortable week